Nigeria is celebrating a milestone in history following its certification as Ebola-free by the World Health Organization. The decision of the WHO follows Nigeria's completion of the 42-day period after the last case was discharged without any new cases recorded in the country. Now, shortly after the WHO announced that Nigeria had become Ebola-free, the Lagos State government held a media briefing where the State Commissioner for Health, Jide Idris, narrated just how the country recorded its success story in defeating the virus.
We've spent the early part of our intervention in containing the disease and reducing deaths. That was our initial effort. As it is now, we will not disband the structures that we put in place. We do not intend to, and we will not, but rather hone on their effectiveness and efficiency. And some of the key factors that helped us, again, in what we did was the political will and support at the highest level of governance, including the governor of this state, again, who played a very active role. Members of the State Executive Council, some of us are here, and others, again, who played their own roles on ground. And again, the activity support by the federal government and all the other external agencies who helped us, WHO, CDC, MSF, UNICEF, etc. There were many. It was a collaborative effort. We had an aggressive and robust system of contact tracing and monitoring. If you recollect, again, we did twice daily monitoring of all contacts, taking their temperatures and immediate evacuation to isolation center upon persistence of spike and presence of other symptoms such as vomiting and diarrhea. Generally, we did not wait for late symptoms and signs such as bleeding and other orifices. But again, once a patient presented with temperature, high temperature, in conformity with what you see, that patient was brought out of that place again and taken to this for further investigation. And of course, we had rapid and complete investigation of suspected cases and deaths, including rumors. You recollect during that period, again, there were rumors peddling out. Somebody died of this, somebody was bleeding of that. One of the things I will tell you, the coroner moved again to investigate almost every single case that was brought, so that we confirm that were not just rumors. And of course, we deployed a robust health promotion and disease prevention plan that involved, amongst others, mass public enlightenment and engagement, effective use of social media platforms, engagement of the print and electronic media, regular press updates, collaboration with Nollywood stars and high-profile musicians, and effective management of rumors.
Now, Idris said, despite the status of being certified, despite the fact that Nigeria is actually Ebola-free, the country would not be letting her guards down. He said the country must be vigilant since the virus is still ravaging other countries in the West African sub-region.
Yes, we've been declared Ebola-free, but we are not out of the woods. And the reason being that for as long as Liberia is what it is, Sierra Leone is what it is, and Guinea is what it is, we can still have new cases here if we are not careful. And that's why we will continue to do everything possible to ensure that that does not happen. Mainland Hospital Yaba has been decontaminated, and we're in the process of restocking, especially our stores, to be able to we will stock everything, what all might be needed, should in case we have any case. That we deal with it as when it comes to it. We need to strengthen the ports of entry activity, especially in collaboration with the federal government, the ports of entry, the airports, the seaports, and land borders. We will continue. These are under federal jurisdiction, but we still work along with the federal government staff to ensure that all the activities going on there will continue to go on. The essence is that we do not want any new case being imported into this country. And that's the major area. That is one area we have to focus on, because the only way any new case can come in is through those ports. And that's why we have to be very vigilant.